You know, at the national government, 2 weeks ago, we launched a level of service assessment that we want to go through all the public health facilities to determine the level of service that is being offered in those facilities. So I passed here to see for myself. You know, when you get a report and you have been to the ground, you are able to link the report, what is written, plus what you saw for yourself. So one is that speaking to the patients, a good number of them are happy with the services. And also walking through, I saw especially their maternity is quite packed, and the women there are very happy with the services that I can say. Walked through the other wards, they are okay. And they have confirmed a good number that they are receiving supplies. A good number have also confirmed that the service is available. The doctors are there, the nurses are there, and I have found many of the health workers in their working stations. Pleasantly surprised that I have also met a good number of interns. I have talked to them again, and they're happy with the services that the hospital is providing. We are going to roll out a national equipment support to counties. So we have discussed with the governor that then he can do his request and list the number of equipment that he would need support from the national government. That they have begun a digitization process. They have a total of 114 facilities, and they are at 70% in terms of ensuring that they are able to link all these facilities. One is that they'll be able to see the HPTs, the health products and technologies, all through stocks. And we want to link them up to KEMSA so that then they can even communicate with KEMSA. That is revolutionary. I think it is the first county that I have been to that has gone that far. Many of them have technology here and there, but with the capacity to link all the facilities within the place, this is the first one that I have seen, and I have asked the governor to be a champion of digitization of healthcare. You know, after this assessment, we want to place facilities into primary care networks, so that then we can be able to provide services to people, and digitization is going to be very important. What I have noticed here is that we have patients who are not from Kiambu, and we have met quite a number who are from Machakos, Kitui. So as a minister then for me is to look at what is the gap in Machakos and Kitui that they are not able to access services there, they are coming to access services here in Kiambu. So that is a gap that when I go back to the ministry, we shall be looking at. But largely, I want to thank the governor for the efforts that he has put in. His staff are happy, equipment available, except the few gaps that we have discussed, and he's going to do a list for the equipments that are missing. Technology, he has employed technology. What we are going to work with him is now on health financing. We have agreed that they'll make sure that the NHIF desks here are working, that they are able to register their people as and when they come. Due to the high maternity cases, we have also agreed that they'll improve their systems to ensure that they claim from the Linda Mama Fund. You know, as a national government, this year we have put 4.098 billion shillings for Linda Mama. So we need all the women who come here to access maternity services, they should be able to claim from the fund so that they get reimbursement. The KEMSA funds were lost to COVID, so they do not have money to keep circulating for products. So we are working on recapitalizing it. Equally, we are speaking to the counties. There are those that owe KEMSA. Cumulatively, counties owe KEMSA 2 billion shillings. But I'm happy that Kiambu County does not owe KEMSA anything. So we are working to ensure that those that owe pay KEMSA so that then we can pay our suppliers and be able to have stocks. I want to assure Kenyans that in the next 2 months maximum, the fill rate at KEMSA is going to be over 80%.